Hello, everyone. Thank you for joining me in this presentation on the co-design of a logic model describing case management for people who frequently call ambulance services. We developed this logic model as part of a National Institute of Health Research funded natural experiment called STRETCHED. My name is Dr. Rabeeah Aslam, and I am the study manager for STRETCHED. So a bit of a background to our study. A small minority of people make a high number of calls to the emergency ambulance service, calling 999. These repeated presentations may be indicative of gaps elsewhere in the healthcare system, which could perhaps be more effectively addressed by proactive care. Now, as we know, the NHS is under sustained pressure. There has been an increase in the 999 calls by 6% every year, and although fewer than 10% of all of these calls actually relate to patients with life-threatening conditions. Now, multi-agency case management is being introduced by ambulance services and their partners in the United Kingdom to try and identify and address the needs of those who call 999 ambulance services frequently. However, there is a lack of evidence of what works in this setting and how. And this is where our project comes in, because we are trying to evaluate the effectiveness, safety, and efficiency of case management. We're working across four sites, the London Ambulance Service, East of England's Welsh Ambulance Service, and West Midlands. So in order to evaluate case management, the first step that we took was to develop a logic model. And the method that we used to develop a logic model is we conducted a stakeholder event with 37 people from Wales, England, and Northern Ireland, which included patient representatives and professional staff in commissioning, planning, and delivery of case management for people who call 999 services frequently. So doctors, nurses, paramedics, people who commission research, etc. We formed 5 discussion groups to address the following questions. What does case management look like? How do you think case management works? How does it affect the person, family, providers, and ambulance service in the NHS? And the responses were recorded, aggregated, and discussed in a plenary session at the workshop, and we use these responses as the basis for developing a logic model. Now, at this stage, I just want to give you a brief reminder of what a logic model is. A logic model is a graphic which represents the theory of how an intervention produces its outcome. Now, relating to our study, logic model is useful because it can help prioritize and structure data collection and analysis to explore the main aspects of an intervention and the relationship between them. Now, this is the logic model we developed to understand how case management could possibly help people who call ambulance services frequently. As you can see, it's divided into 5 components: situation, input, predicted mechanism of change, impact, and mediating factor. The situation is, yes, there's a high dependency on 999 services by vulnerable patients who call frequently into case management. When we talk about case management, what are the kind of inputs do we need? Now, inputs are resources and activities. Resources are tangible and intangible things that you need to make an intervention work. And activities are tasks or actions taken which will produce a certain output. So in this situation, the resource would be an agreed definition of what qualifies as a person who calls an ambulance service frequently. Like, how many times do they need to call for them to be qualified as a person who calls ambulance services frequently? Key workers is another resource. Training for staff, that's another resource. Now, in activities, there's flagging and identifying of high intensity users, information sharing on patient needs and resources across the sectors, multidisciplinary team meetings. Now, this leads us on to the predicted mechanism of change. Why do we think the case management can actually work? And that is because it's personalized. There's a tailoring to identify the key issues that a person is maybe struggling with. There's a negotiation in patient health-seeking behavior, so there's a development of resilience, an increase in self-efficacy, a shift in attitude towards risk. And most importantly, there's supportive cross-sectoral professional input to resolve clinical needs that a patient might have. This leads on to an impact, to a possible impact, which is an increase in patient satisfaction with care, a patient activation, say a sense of control, and increase in staff morale. There's a reduction in number of patients who call frequently, a reduction in patient-reported anxiety, and a reduction in adverse events, for example, self-harm behavior, and the number of emergency contacts per person. The mediating factors goes across the 4 components, which actually these are the things that you need to make this logic model work. So, for example, the acceptability of alternative care pathways to patients and carers, and the organizational culture that exists within the ambulance services. Thank you for this opportunity. I look forward to hearing from you.